Hi, I'm Julie Beckham, and this is an ASRM Career Close-Up interview. Today, I'm joined by Dr. Amy Sparks, who is the director of the IVF and Andrology Laboratories at the University of Iowa. Dr. Sparks is the past president of SART, and at the time of recording, she's also the president-elect of ASRM. Dr. Sparks, congratulations on all your accomplishments, and thank you so much for joining me.
Oh, thank you. I really appreciate this opportunity.
So we want to talk about your career and let's just start with what initially drew you to the field of reproductive medicine. And did you envision this specific role early in your career?
I really enjoyed my reproductive physiology courses as an animal scientist in my undergraduate years, and I was drawn to study reproductive physiology, but I definitely didn't have clinical assisted reproductive technology on the forefront of my mind as far as a career goal. IVF was fairly new then. I finished my PhD in 1992. And while there were several clinics forming at that point, success rates weren't fantastic. And it seemed to be a little bit of a dicey career path. So I was really aiming for a faculty position, doing basic research. Um, but as my graduate studies changed and I was doing the flashier transgenic work and looking at joining biotech companies, I did come around to seeing the progress in IVF and haven't looked back since. But it wasn't, my day one goal, like it can be for many people today
Right.
because we have solid programs.
So just tell us a little bit about what you do. Like, what does a typical day or week look like for you?
As a lab director, it can be varied. You can be stepping in to fill in staffing needs in the clinical lab. You can be organizing the schedules of your staff. You can be looking at statistics, all of your data, to measure your key performance indicators and make sure your lab is performing as best possible. And then making plans for future patient care. We have a lot of patients coming in. We know that we've got to get sperm in for this patient or ship embryos in for that patient. So it's a lot of planning. And that's my day job. Otherwise, staying current on literature and helping serve in a variety of capacities with my networks and with ASRM take up the rest of the time.
And thinking about your career, was there a pivot, a detour, or unexpected opportunity that ultimately led you to this role?
Yeah, I have to say my first position out of graduate school was at a fairly small IVF program that frankly was struggling. And I thought, gee, did I really choose the right place? But they gave me the advantage of being allowed to visit large programs. And I visited both Brigham as well as Cornell and met with their laboratorians. And building that network really helped me. And when I made the decision to leave the program I was at, I reached out to those people that I had met on those trips. And it was through a connection at Brigham that I brought me to University of Iowa. This was pre-internet, so it was word of mouth that led me to learn about this position. And I can say I've been incredibly happy here at the University of Iowa for 32 years.
So, can you share a moment that reaffirmed that you were in the right career?
Yeah, I would say early 90s, we were struggling because we didn't have intracytoplasmic sperm injection yet. And so when we started performing it in our laboratory, it was hard. We didn't have the right vibration control and things like that. But when I got my first fertilization with ICSI, I still remember it. I called my attending physician, woke him up at 6 in the morning to tell him the good news, and he thought, "Why are you irritating me at 6 in the morning?" But I was so excited, and it's those steps because we've had so much change in this field, and there's so much to learn, and the textbooks from which we learned have had to be rewritten because what we learned was ICSI should never work. And yet it does, and it's used in the majority of cases and has been a wonderful tool to treat male factor infertility. It's those changes. This is an incredibly exciting field, and it's forever changing and improving.
That's very interesting to think about the early days before everybody did it all the time.
Well, it was just a lot of failure. I mean, IVF was a lot of failure. It was very unsuccessful. 18% pregnancy rate. Woohoo! It was hard to get excited. So when you're making these leaps, it's just so exciting.
What are some of the biggest challenges that you face in your role, and how have you learned to navigate them?
I think one of the biggest challenges as a laboratory director is we may have the scientific training and background that we need for our work, but we are not trained at all in personnel management and some of the business skills that are needed for lab direction. So I think, unfortunately, you learn the hard way. You learn through mistakes and you learn from those mistakes and you want to improve. That's part of a typical quality improvement program. And you're always working on improving yourself in the areas that you don't necessarily have the strongest background.
So, how has the field or your role within it evolved since you began?
Well, when I began, we were making our own culture media. We were culturing embryos for only 2 days, transferring multiple embryos to patients, praying that 20% of those patients would get pregnant and hopefully not with more than two embryos implanting. Twins were very common then. We have had vast improvements in embryo culture and allowing us to culture embryos out to day 5 before transfer or day 7 before freezing, allowing us to select embryos with higher reproductive potential than when we were making a decision on day 2. Obviously, intracytoplasmic sperm injection made a tremendous change for treating male factor infertility. We moved on to surgical sperm retrieval. We're freezing eggs. I remember, egg cryopreservation was research only for the longest time, and that was a real struggle to get that approved and move it out of the research category. And today we're receiving shipments of frozen eggs from donor egg banks all over the globe.
Wow.
It's amazing. And pre-implantation genetic diagnosis certainly, and pre-implantation genetic testing overall has also made a huge change in our field. Uh, we work very hard. We have good success rates. We've improved access to care. Now we just need more people to provide the care to answer the call as access has improved.
So much change in just 3 decades.
Yeah, it's exciting.
What misconceptions exist about your career path or your line of work?
I think for this line of work, I will see social media posts about people complaining about their work hours and having a really difficult time in their workplace getting time off, and that does exist. Unfortunately, I think some programs just haven't recognized the ASRM practice committee guidelines for labs and recognizing the amount of staffing that it does require. I'm happy to say that there are programs that are adjusting their staffing levels to meet the recommendations. And while I don't know that we're achieving the work-life balance is ever going to be something in my generation, I think that we are getting closer with the younger generations where people can leave work, not think about it at all, work 40 hours a week, and know that they're providing great patient care, but there are other team members to do the work as well.
That's certainly the dream, right?
Yeah, it is.
What backgrounds or training paths can lead to your career?
And that is a very difficult question, and that's one that I know leadership is struggling to, not struggling, but really wanting to try to define. I don't know that there's any particular path. There are multiple paths, and they have to touch upon biology, have some if you have some clinical experience, it's really helpful. But if you don't have any clinical experience, there are ways to learn and adapt to clinical laboratory medicine. Um, I wish I had the magic answer for you for that, but it really depends. And I've had staff that have come to me with animal science backgrounds, research backgrounds, pathology, um, and one that had worked in industry working for a DNA manufacturing company, sequencing company. So backgrounds are varied, but you have to have the educational requirements if you're working in andrology that are laid out by CLIA, Clinical Laboratory Improvement Act. For embryology, it's a little bit softer, a little bit more flexible.
What skills or experiences outside of science or medicine have helped you succeed?
I think a lot of my volunteer activities have helped, obviously, in learning how to work with groups and people with different backgrounds. I think that's a really important skill that you need to bring into the lab because you never work. You sometimes have to work independently, but most of the time you're working with a team. Um, Public speaking is always helpful. You don't necessarily need it, but it certainly helps when not only meeting with patients, but also educating groups about our field. I meet with a lot of high school groups trying to teach kids about this field and discuss career opportunities. And I go from high school to international meetings. So
Wow.
those are some of the skills that are really helpful.
How have professional organizations, mentors, or networks supported your career development?
There's no way I would be where I am today without the support of the networks and professional societies. I think back to my early days in IVF where I was able to pick up the phone and call Lucinda Beek, the first embryologist in this country, and she answered the phone and answered my questions. And through my work in the American Society for Reproductive Medicine, I've been able to form some tremendous networks with embryologists and andrologists, and always know that I can reach out to anyone in those networks when I've got a question. And rarely does a day go by when I'm not reaching out to a colleague with a question, or once in a while I might provide an answer. But they've really that has led to the development of my career. I couldn't have done it without those resources.
Excellent. What's one piece of advice that you wish you had received earlier in your career?
Um, I think it would have been helpful to know how to structure my days, weeks, and months a little bit better and not burn out quite so much early in my career. Um, Learn how to delegate. That is job one, but you have to have staff that you're willing to, trust when you're delegating and they need to answer the call when asked. I think those are a couple of the things I wish I had known earlier, but with time, you develop a team, you have great trust in everyone you work with, and goes, it becomes a ballet. I think that's the best. We're always dancing together and working together, and the work flows, and it works beautifully. Ballet or orchestra, whatever artistic group you want to think of. That's what I think of the lab.
So, one final question for students or early career professionals exploring reproductive medicine, what advice would you give to them?
I would advise them to try to shadow in a lab, if possible. I know not all labs are excited about hosting people, but I know my lab often hosts guests to shadow and learn more about the career. Um, don't always, I think when you're looking for positions, you have to balance geographical choices and workload volumes and things like that. Sometimes what you think is going to be your best choice isn't. I can honestly say I never thought that I would end up at the University of Iowa, and yet we've built this great program here, and I love serving the Midwesterners. So keep your mind open, and the opportunities will come to you.
Dr. Sparks, thank you so much for joining us today, for giving your time and letting us learn a little bit more about your career and how your career path was shaped.
It was just a pleasure. Thank you so much.